our health lead, the CDC this afternoon encouraged all 16 and 17-year-olds to get their booster shots after the CDC gave the final thumbs up this afternoon for the teens to get a third dose. But a new survey from the Kaiser Family Foundation finds that most parents in the U.S. still have concerns about how safe COVID vaccines are for children. Let's discuss this with Dr. Chris Purnell, a public health physician, and Andrea Bonior, a clinical psychologist. Dr. Purnell, let me start with that study. 49% of parents say they did vaccinate their children. 13% say they are taking a wait and see approach. 30%, that's 3 in 10, will, quote, definitely not get their kids vaccinated. So safety and potential side effects continue to be the most prominent concerns. But this is the most researched and scrutinized vaccine to date. If parents don't have the information they need to trust this vaccine as of now, who do you blame? The government?
You know, Jake, this is a difficult one, and this is something that I face in community every day. And I actually would say that parents of children in the 5 to 11 age group are even more skeptical of the safety of the vaccine. And I think it comes from parents being in an environment and atmosphere where at times we've had conflicting messages and that this pandemic has been politicized. And that's very unfortunate. And the best way to break through that is just to be clear and emphatic about what the science shows.
And Andrea, two-thirds of parents also say they do not want schools to require eligible students to get vaccinated against COVID. At the heart of this, it seems, is parent frustration with how much the pandemic has taken from our children: at-home learning, no socialization, mask requirements, etc. What do you make of this lack of desire for another requirement, even though their kids are required to get vaccines for all sorts of other diseases?
Yeah, I think exactly as Dr. Purnell said, there's been so much baggage of misinformation this entire time that it's become such a loaded subject. But there was one optimistic piece of news in that same study that said that when schools themselves encouraged and provided information about access to the vaccine, it actually increased vaccination rates among children. So even though parents clearly are not all for it being a requirement, it does speak to a need for local and state school districts to be able to disseminate information. We know there's so much misinformation out there. And so it's not a surprise that a lot of parents who were skeptical about the vaccine for themselves are saying absolutely not for their children. We need to counteract that misinformation.
Dr. Purnell, what sort of resources do you think these parents and kids need to better understand this vaccine and so that we can all get past this pandemic?
I think we all need to be on the same side of this argument. And what I mean by that, I think healthcare leaders, those in public health or clinical medicine, as well as educators, and as well as families' personal primary care physicians and pediatricians, we all need to say the same message emphatically and clearly. And that is that the safety and the efficacy data is on the side of getting these vaccinations. When I've been before parents, Jake, whether I'm on school grounds or I'm doing it virtually, the more that I'm able to answer those questions and to tease out the misinformation from the fact, to use social math, or so we say, give them examples of flu versus COVID, and then talk about how this vaccine really is our way in society as beating back this pandemic. You see parents, if you will, thawing to the possibility that maybe I should do this for my kid, because we're not going to finally cross the finish line until we have a substantial proportion of all of our population vaccinated.
And Andrea, you and I have been talking about the damage this pandemic has caused kids since last year. And there's this new study in JAMA showing there was an almost 66% jump per month in cases of anorexia among girls between the ages of 9 to 18 years in Canada during the first wave of the pandemic. Let's talk about, tell me about your observations of the toll this has taken on kids, maybe especially on young girls.
Yeah, young girls, I think it's so tied up into social media as well, because we've had that recent Instagram data about just how damaging certain aspects of social media can be to girls in particular about body image. And so when you think of one of the things that has happened with the pandemic, it's that our children's and our teenagers' social lives have moved so much more online, even than ever before. So any kind of influences in terms of substance abuse, in terms of self harm, in terms of eating disorders, have only been magnified because that's the only way that a lot of these kids were actually able to interact, and that became their life. And we know that the data is damaging. We know that when they're constantly exposed to over idealized body images or even behavioral techniques about how to do some kind of unhealthy eating behaviors, we know it has real effects. And it's a real concern going forward because I don't think that we can put the genie back into the bottle. These kids are online all the time now.